Welcome to Why I Vaccinate, a brand new show on WJR presented by the Franny Strong Foundation and the Michigan Department of Health and Human Services. I'm Ann Thomas, and I am here with my co-host, Veronica McNally. And Veronica, our first guest on the show today is someone that I admire greatly. She's one of our Women Who Lead, WJR's Women Who Lead, Dr. Joneigh Khaldun, the Chief Medical Executive and Chief Deputy for Health for the Michigan Department of Health and Human Services. And Dr. Khaldun, welcome to the show. It's great to see you.
Oh, thank you so much for having me on.
So let's just kind of start out and tell Veronica and myself and our listeners, how are things going in general with Michigan's COVID-19 vaccination efforts?
Things are going well. I'm quite pleased. We have over 8.9 million doses of one of the three safe and effective vaccines that have been administered across the entire state. Over 75% of people over the age of 65 have gotten a vaccine. And because of our success, that is why we've seen our case numbers and our percent positivity rates for COVID-19 come down like they have. So I'm quite pleased with our vaccination efforts.
What are some of the techniques and the strategies that the department is using, that you're using to get people to actually get vaccinated?
So I think one of the most important things is access. We know that not everyone has a car, not everyone is willing or wants to come to a mass vaccination site. And as we've seen our supply of the vaccine increase and at this point outpace our demand, we know making vaccines as accessible as possible is the way to go. So we've been working very hard to make sure that our primary care doctors, our pediatrician offices, even our community-based organizations and our pharmacies all have vaccine available. When someone is ready to get the vaccine, we want that vaccine to be available at that time. I think another important thing that we've been working on throughout our vaccination effort is communication. It's so important that people have access to facts about these vaccines. And it's okay for people to have questions. We certainly don't want to shame anyone for having a question about the vaccine, but we need for there to be spaces and places for people to have those questions asked and answered. And that is what we are doing all across the state.
And Dr. Khaldun, we know some people are still concerned and they don't want to get the vaccine. What would you say to those people about the safety and the efficacy of this vaccine?
Over 250 million people across the entire country, that's just the United States, have gotten one of these vaccines. They are safe, they are effective, and quite frankly, they are saving lives. So I think it's really important that people do not delay. We know that people who have gotten vaccinated are much, much less likely to get COVID-19. And if they do get COVID-19, they are not going to be hospitalized and very unlikely to get severely ill. So these vaccines are the way to not just protect yourself, but also your loved ones in your community. So I would really encourage people to not delay a day longer when it comes to getting vaccinated for COVID-19.
And we recently talked to Governor Whitmer about this, and she did a really nice job describing the feeling of being vaccinated. And once you're vaccinated, all the different things that you can go and do. And I'm sure you feel the same way.
Absolutely. Vaccines are the way that we are going to get back to normal. The CDC has put out guidance. People who are vaccinated, by and large, can do the things they were doing before the pandemic, not wearing masks, not needing to worry about social distancing, even if they're exposed to someone with COVID-19 and they don't have any symptoms, not needing to quarantine or to get a test. So absolutely, these vaccines are the way to get back to normal. And I've been elated for myself and my family members to get vaccinated. I'm quite grateful.
And Veronica McNally, I know you've got some questions for Dr. Khaldun.
I do. Dr. Khaldun, thank you so much for joining us today. What are some of the common questions you're getting from people about COVID-19 vaccinations?
A lot of people have questions about the side effects or may be concerned. I know some people are concerned about having a fever and what that's going to mean after they get the vaccine. But I can tell you the side effects from the vaccines, based on the data, again, millions of doses across the entire country, the side effects are mild. The most common ones are pain in your arm where you had your vaccine, and sometimes a low-grade fever that doesn't tend to last more than a day or so, if even that long. So the side effects are very mild. And I think, again, the benefits of getting this vaccine and preventing COVID-19, and not just a COVID-19 not needing to be hospitalized, but long COVID. We're learning more and more about long COVID and people having these long-term health consequences of COVID-19, fatigue, chronic headaches, feeling chronically short of breath. This vaccine is something that, again, it works and it will prevent you not just from getting COVID, but also long COVID and having those long-term consequences.
And Dr. Khaldun, are those the things that you tell people who are on the fence about a COVID-19 vaccination?
Absolutely. You know, I've also been lucky. I still work in the emergency department at Henry Ford Hospital, and we are now at Henry Ford Hospital offering vaccines in the emergency department. So I've been able to actually talk to my patients in the emergency department about their questions about the vaccine, and I've been able to get some of my patients vaccinated there as well. So absolutely, that is what I talk to them about. Again, just having a conversation. What are your concerns? Why have you delayed? I think sometimes people just haven't gotten around to it. They haven't seen it as a priority. And so again, that's why it's so important. Every single interaction that a medical provider has with the patient, we have to really maximize that and make sure we're talking to patients about the importance of COVID-19 vaccination.
I want to talk a little bit about the COVID-19 vaccination for children. So right now, children 12 and older can get a COVID-19 vaccine, and there are clinical trials ongoing for children younger than 12. What do you think parents should know about COVID-19 infection in children and why vaccination is important?
Absolutely. It's very important for children age 12 and up to get the COVID-19 vaccine. I have two children in that age group, and I was excited for them to be able to be vaccinated, and they're now fully vaccinated, which is incredibly exciting. So again, we know that COVID-19 is more rare in children. We have seen the most significant severe disease and hospitalizations in older people, particularly those with underlying medical conditions. But that said, children can absolutely get COVID-19. They can absolutely spread it to other people, and they can get very, very sick. We have this very scary syndrome called MIS-C, so multi-inflammatory syndrome in children. And some children have actually lost their lives because of this syndrome associated with COVID-19. So it's very important. These vaccines, again, have been studied in children. The process for these vaccines to be authorized is very robust, and it's so important for our children to get vaccinated as soon as they can. That is the way they're going to be able to get back to in-person learning and stay in school, not have to quarantine and not have to be worried about getting sick.
Dr. Khaldun, what's the latest information about those of us who have been vaccinated and whether or not we'll need a booster or a yearly vaccination?
That's an excellent question, and I've been in regular conversation and communication with the CDC about this. There are many studies that are ongoing about how long our vaccines that we've already gotten would last. We don't know at this point whether or not we will need a booster dose. I will say that we in the state, working with our local partners and also at the CDC level, we are absolutely planning for if we would need a booster shot, how we would be able to make sure everyone has access to those doses. So a really important question. Unfortunately, we just don't know the answer yet.
Now, what about masks? What's your latest opinion on masks? Is there ever a time when we should still have a mask in our pocket?
So masks are probably one of the most important tools that we have to prevent the spread of the virus outside of course, getting vaccinated. And so masks work. And masks, quite frankly, are why we've been able to have many of our schools maintain in-person learning throughout this pandemic. So masks do prevent the spread of the virus, particularly for people who are not yet vaccinated. So perhaps you have an underlying medical condition, or your physician has said you should not get the vaccine, or again, you're not eligible yet to receive the vaccine. So those are people who should really still be wearing masks in indoor spaces, especially indoor public spaces. That is where you're going to want to make sure you're wearing a mask, particularly if you are not vaccinated yet.
And how do you feel finally about antibody testing? Do you ever see a time where we could all possibly be tested for the COVID antibodies and then a decision would be made about whether we did need a yearly vaccination or the booster shot?
The science is still out on that. I know in the beginning we wanted to be able to get this antibody test to know if we had COVID and determine whether or not we were already immune, but the science isn't quite there yet. We have antibody studies across the country that can help us understand how the virus may have spread in the community and to give us estimates for how many people may be immune. But we also know that right now, even people who have had COVID-19 in the past, their antibody response may not be as strong to prevent an additional infection. And that's why the CDC is still recommending that people who have even gotten COVID-19, after they are finished with that acute illness, that they still go ahead and get vaccinated.
Dr. Joneigh Khaldun, Chief Medical Executive and Chief Deputy for Health for the Michigan Department of Health and Human Services, thank you for your time today. We really appreciate it.
Thanks for having me on.
We also appreciate all of your guidance during this horrible time period during the pandemic, so thank you.
Thank you.
And you are listening to Why I Vaccinate. Coming up next, I want you to get to know my co-host, Veronica McNally. Stay tuned.